Now we're on to the lip depressors. So this starts laterally with the depressor angularis oris. So this muscle pulls down the corner of the mouth and is treated specifically to cause the opposite effect. As you get older, lost fat and lost resistance to movement can result in a downturned mouth. And if you relax that muscle, the opposite can occur. We put roughly 2 units into each muscle for a small lift to the corners of the mouth. Medial and deep to that is the depressor labii muscle. Now this muscle is involved in pulling the lip outwards. Certain people have quite a strong muscle. I always think of Cherie Blair, who famously had quite a strong lateral pull, and you'd see all of her lower teeth when she was smiling. That's a strong depressor labii muscle. Medial to that, we have the menntalus muscle. The menntalus muscle pulls the chin up. It starts on the bone in the middle of the chin, and then its fibers go down and meet at the point of the chin, where you can often see them, where they cause that little indentation, sometimes called like an ice pick shape or an orange peel effect on the skin. And this is just the muscle fibers pulling the skin inwards, which is one of the reasons why you might treat this muscle. You may put up to 4 to 6 units in to reduce the texturing on the chin, but also to help the chin lower down so that the chin remains the low point of the face. Remember, that's one of the cores of beauty, is a heart-shaped face where the chin is the low point, and a botulinum toxin treatment in the menntalus muscle can aid that strategy. The next muscle we never really treat with botulinum toxin, but it's worth knowing about, which is your buccinator muscle. This muscle runs on the deepest surface of your cheek, and above it is a fat pad. But this muscle is 2 interesting things I know about it. Firstly, it's the strongest muscle in a baby's body because it's used for sucking, for breastfeeding, or sucking in a bottle, and also because it is used in bugle players particularly. It's sometimes called the, what's it called again, David?
It's literally just called the bugle muscle.
Okay. Sometimes called the bugle muscle, I discovered today, thanks to my researcher, David. Next muscle is on the other side of the fat pad above the buccinator muscle, and it's your rorous muscle. This muscle is interesting because its origin is actually the surface of the masseter muscle, and it contributes to smiling. The main reason we come across it in medical aesthetics is actually as a side effect of treating the masseter muscle. We accidentally relax the rorous muscle, and it affects the smile of a patient who wanted jawline slimming but instead got a reduction in their smile, which is not a nice side effect at all, and it comes from hitting the origin of the rorous muscle just where it attaches to the masseter muscle. You see this muscle most active in faces during a really good laugh. When all the muscles are contracting and pulling sideways, you'll see the rorous muscle.